Meanwhile, an alternative to Obamacare, Senator Rand Paul and Congressman Mark Sanford unveiling their proposal for an Affordable Care Act replacement. Senator Paul spelling out the main components of the bill. Take a listen.
It's going to legalize the sale of inexpensive insurance. It's going to expand health savings accounts so people can save to buy their insurance. And it also allows individuals to join an association so that they're not left out in the cold by themselves to buy insurance in a small insurance pool. And these associations will give them leverage to get lower price and better insurance.
The legislation has been endorsed by the House Freedom Caucus, where Republican Congressman Mark Meadows is the chairman, and he joins me now. Congressman, thank you for coming in. It sounds like by piecemeal, doing the various things that we're doing, Obamacare itself doesn't have to be repealed. It is going to become gutted, essentially, because the main components of it aren't there. So you don't even have to repeal it with all these measures.
Well, I wish that were the case, David. Obviously, the components that you're talking about and your analysis is right. As we start to look at our replacement bill, that would make the Affordable Care Act obsolete, but it's in statute. And so what we propose is not only doing a full repeal of the Affordable Care Act, but on the same day, hopefully voting on Dr. Rand Paul and Governor Sanford's bill that is a companion bill. It's bicameral, both in the Senate and the House.
Right.
And hopefully we'll start to see that it picks up a lot of steam.
But
we have
already you're beginning to see these cuts. I think of the phrase a death by a thousand cuts. One of them, just as an example, is the IRS no longer is forcing taxpayers to say whether or not they have insurance. So the IRS won't be used as an enforcer for Obamacare, for the mandate, the health care mandate. That means that there is no enforcer for that mandate, right?
Well, and that we can thank President Donald Trump for that, and you're exactly right. But there's a couple of other mandates, David. One is the insurance mandate, and the other provision, what they call essential benefits. So it doesn't allow the insurance companies to offer cheaper insurance. Right. And it says that if you're going to do it, you have to put all these things in it, and so it drives up the cost of insurance. So our bill actually addresses those components. So we're looking to work hand in glove with the new administration to make sure that the Affordable Care Act ultimately gets replaced by something that truly is affordable.
Well, do you need, I'm just wondering if you need a replacement, a government solution, because if you take all these cuts away from Obamacare and essentially you create conditions by which the free market can create new products to replace the government products that had existed, that's all you need.
Well, Dave, based on that, you're going to get an invitation to join the Freedom Caucus. We couldn't agree with you more. When we look at this, we have got to make sure that we allow the markets to come back and yet at the same time provide some safety nets for those that perhaps can't afford it. And the other aspect of that is those pre-existing conditions. Right. Our bill addresses that, but it's all about allowing the markets to drive the cost down. We've seen that in the telecommunication business. When you deregulated it, long-distance rate went from $1.05 to 5 cents a minute.
Congressman, producer, who was it that said that? The Aetna CEO just said that Obamacare, and other CEOs have said this, is in a death spiral. This is the Aetna CEO. Would you agree with that assessment?
It's not only in a death spiral, it's about to hit rock bottom. So whether it's Aetna or Humana or Blue Cross Blue Shield, we all know that it's not working. The exchanges are going bankrupt. It's time that we make sure that the American people have affordable health care.
Well, and our business community, our free market can create products, whether it's in health care or anything else, to replace these government solutions. Congressman, thank you very much. Appreciate you being here.
Thank you, David.